So tell me, is being obese in and of itself a risk for patients going into surgery?
Obesity itself is related to worse surgical outcomes across a broad spectrum of surgeries. So in many surgeries that have been looked at, surgical site infections are increased, complications as far as the wounds are increased, hernia development is increased. So obesity in and of itself, no matter what the disease process was that brought the surgeon there, is an increased risk for that patient for particular types of complications that can be serious. And it's not that these are minor complications. These can be significant as far as risk factors for the patient, as far as long-term recovery, costs, readmissions to the hospital. All of these things are increased by obesity in and of itself.
Okay. Now I want to ask you about actually operating on patients. I mean, you're using different instruments these days because you have overweight, obese patients.
Sure.
So tell me a little bit about those. Why do you have them? And you have one example you want to show us.
So the reason why is it's basically a space issue. In order to get to where we need to get, there's more of a patient. The visceral obesity that we're seeing in patients makes it more difficult because it's not like their organs get bigger. It's the distance from their organs to where we are is getting bigger. Because the distance is getting bigger, now instruments are becoming much longer. And the reason why is because you want to keep that focal distance outside the patient the same, because that's for me to operate. If I had to use this instrument on the thin person, I'd be operating inappropriately and increasing the risk of some technical problem. So we're designing and redesigning new equipment just for obese patients. And this goes not only for laparoscopy, but also for open surgery. This is a traditional handheld retractor, so this would be held on the wound edge. This is one now for obese patients. And you can just see that in order to get the lever arm you need a wider area because you're keeping things, you have to keep more tissue away from the wound edge. And so this little one wouldn't work. So we're redesigning, and every time we have to redesign a piece of equipment, it increases the cost. So that's the problem we're facing in the OR.
Okay, and outside of the OR, the hospital in general, they have to be changed to accommodate the bigger patients in the operating room and in the patient room. What are some examples of that?
So it goes from fundamentally just how you move the patients. It used to be we could just pull a patient off of the bed onto the gurney, but as patients have gotten larger, you can't do that safely. You just don't have the force you need to. So we have to buy or just redesign design operating rooms and ORs and the beds and the procedural areas all have to be redesigned to accommodate patients. Now we're looking at what used to be a 500-pound patient was extremely heavy. We're designing ORs and equipment to move patients, to have lifts in the ceiling, to have special types of wheelchairs, special types of beds that can accommodate patients that are 700, 800, 1,000 pounds. All of that is a real difficulty for hospitals to re-engineer their infrastructure, because you can have a bed for a 1,000-pound person, but what if you don't have the doorway for that bed? So now you have to start taking down walls, and as we know, when you're remodeling, that's a problem.
And so you're coming from the Mayo Clinic, which has these facilities built in. What about all the hospitals, the smaller, the rural hospitals? Are they going to be able to cope with these patients in the future?
They're not going to be able to cope with them in the sense of the facilities needed to safely handle them and safely handle it for their staff. And so I think we're going to start seeing sort of a migration or forced migration of these patients to centers that are able to do that. Now, not all centers can do it, and not all our rooms. We had to renovate specific areas, but the question now becomes, do we have to renovate all our rooms to accommodate these patients? Because what happens if you have 25 rooms designed for obese patients? What happens when you're number 26? So you really can't design just a wing for obese patients. You need to redesign the hospital because you never know when someone's going to come in. So I think there is going to be an infrastructure reinvestment in hospitals that's going to have to deal with this obesity crisis if it continues as it is. And there's no signs that it's going down.